The rate of cesarean section has increased to approximately around 30%, and by the increase in the rate of cesarean section, the incidence of cesarean section defect or niche or isthmocele or uteroperitoneal fistula or diverticulum has increased, according to some studies, up to 24 to 70% of these patients. So what it happens, although the exact cause of this issue of a niche or isthmocele is not known, but we believe it has a lot to do with the surgical techniques. One layer closure, sparing of the endometrium, locking sutures, infection, the very low level of the incision could be all contributing factor for formation of the cesarean section defect. And this defect, it could contribute and cause abnormal uterine bleeding. It could cause spotting, dysmenorrhea, dyspareunia, pain, and secondary infertility, and also sometimes ectopic pregnancy at the site of the previous cesarean section. And it looks like to the eyes that are not trained at the time of hysteroscopy, it looks like another cavity. It is a concave shaped cavity at the anterior wall of the uterus at the site of the previous incision. The best time to diagnose the isthmocele or the niche or the fistula is right after the period by hysteroscopy, but sonohysterogram, MRI, and ultrasound also can be used for the diagnosis. For the repair, there are several different ways we can repair it. If the patient doesn't want to get pregnant, or there is the possibility of the surgery is not easily available, hormonal therapy might work very easily. If the patient wants to get pregnant and the thickness of the myometrium is less than 3 millimeters, we have been for years repairing it by laparoscopic approach. The way we approach it, we get to the vesicovaginal space and we remove the fistula tract and we repair it in 2 layers. And this would hopefully help and eliminate the niche, and also would eliminate the risk of the rupture to a large degree. We don't recommend the patient get pregnant right away. We would like them to wait at least 6 to 8 months and preferably 1 year before they get pregnant, like a cesarean section. If the problem is only bleeding, by hysteroscopic approach, it is a very easy 4 or 5 minute procedure. You can resect the fistula tract and the fibrous tissue around the fistula tract, which acts like a valve and causes a spotting and bleeding. So we can resect it very easily by hysteroscopic approach. And of course, if the patient doesn't want to get pregnant and she has other problems like adenomyosis, hysterectomy is also always an option. And in summary, by the incidence of a cesarean section increasing, the chance of isthmocele has increased also, and it could be managed hormonally, vaginally, hysteroscopically, or laparoscopically, depending on the desire of the patient. Thank you very much.